The nation's top doctor is calling for a tobacco-style warning label on social media, saying it poses a mental health crisis among young people. This is already attracting attention in Wyoming, but first, Elizabeth Schultz is in Washington with details on what the U.S. Surgeon General plans to do.
The U.S. Surgeon General is calling for warning-style labels on social media, similar to what you'd see on cigarettes or alcohol products. In an op-ed for the New York Times, Dr. Vivek Murthy writes, a Surgeon General's warning label, which requires congressional action, would regularly remind parents and adolescents that social media has not been proved safe. He says that similar labels that were put on tobacco products help dramatically reduce their usage. Now, Murthy points to data showing that teens who spend more than 3 hours a day on social media face double the risk of anxiety or depression. The average user that age was on social media for almost 5 hours a day. Last year, Murthy sounded the alarm about how social media is contributing to a mental health crisis among younger Americans. He has urged Congress to pass legislation that would stop platforms from collecting data about minors and put restrictions on features like push notifications or auto scrolling. And while there is bipartisan support in Congress to put guardrails on social media, none of those measures have passed.